Based on the science and the implications of what we're finding scientifically, I am anticipating an explosion of brain bleeds. And I'll be taking you through why I say that and why the science is also pointing to this as well. Record this time because we are now in April of 2025. This is going to be a major discussion in medical conferences within the next few years. But you are getting this information right up front because the implications, I'm going to start to give you an insight into what it means. And it's all related to a paper that has just recently been published: expression of SARS-CoV-2 spike protein in cerebral arteries, implications for hemorrhagic stroke post mRNA vaccination. Now, as usual, this kind of research is done by the Japanese. I have grown to truly respect science and medicine in the context of the Japanese because they seem to be one of the few who ask hard questions. They are not following a narrative, they are noticing patterns that are abnormal, and critically, they are doing autopsy studies. This is where they have differentiated themselves from everybody else. Everybody is just talking about stuff and saying, well, we don't think this is, or we don't. The Japanese do the autopsy and histology studies to try and understand it. And this is what I'm going to be showing you today. For anyone who has followed me, they will know I have been screaming from the rooftops that we need to be doing autopsies, histological analysis of tissue, to understand the implications of vaccine immune priming and subsequent infection and reinfection and vaccination and reinfection. We have never seen this before. This is going to bring us new pathology, as is being demonstrated here with the Japanese. I'm going to take you through some of this paper, and I'm just getting a chance to look at it today. So I'll have to be looking in more detail in the near future and breaking some more insights. But it's answering a question that I had a few years ago because evidence coming out of Denmark when they were looking at neurological implications after they had done their mass vaccination campaign and they were getting more infections, they were noticing a number of changes. One of them is that ischemic strokes seem to be going up, and I'll explain a little bit about that. Hemorrhagic strokes were increasing as well, as was Parkinson's and dementia. But the one that increased the most was hemorrhagic strokes. This paper is probably going to help us to understand what is going on. So let's start with the basics. And this is just to help you to understand the science as to how it links with what the Japanese were finding in terms of their research. There are a number of types of strokes. We just break it down into two categories: ischemic stroke here, and this is a stroke where a clot blocks a blood vessel. And then you have a hemorrhagic stroke, and this is where a blood vessel has burst and blood has leaked. The most common form is ischemic stroke, about 85%, and 15% for hemorrhagic strokes. And that's an important differentiation because the point here is that what would it mean if we start to see more hemorrhagic strokes? What people don't quite understand, you would think they're one and the same. But the reality is that because the hemorrhagic stroke not only damages the brain where it has bled, but because of swelling, extra swelling in the brain because of the leakage of blood, it can oftentimes do far more damage and it's far more likely to be lethal than an ischemic stroke. So they are very serious and we don't underestimate them. Here is a closer image of what can happen. And I have got here, this is a blood vessel. And you can see here that the blood vessel wall has ruptured Blood is leaking out under pressure because it's an artery, and so it bleeds until the pressure stops it, and then the blood vessel blocks off. It can leak on the outside. If it's an subarachnoid, that means the blood vessels on the outside of the brain bleed, or it can bleed on the inside of the brain, an intracerebral hematoma, which can then cause problems inside the brain. And that pattern, based on the science, suggests that this has to continue to increase. This is why I said in years to come, we'll be having conferences discussing about that percentage of 85 to 15 may shift to 70 to 30. Who knows? This is pretty serious stuff. So here is just another image to help you understand the principle. This here is the kind of blood vessels. This would represent what we call the middle cerebral artery, one of the main blood vessels involved in a stroke, and it then goes on to supply the other parts of the brain. But if you imagine one of the big branches popped inside the structure of the brain, this hematoma here would then cause swelling, damage to the area that is bled into, plus surrounding damage. If these are very big, which they can oftentimes be, it can be a terminal event for some patients. So, as I said, not to be underestimated. And when we look for it in terms of a CT scan, it can oftentimes look like this. So this gray part here represents the brain tissue. This black part here represents the ventricles in the brain, full of fluid, cerebrospinal fluid. And white here, bright white, usually indicates is that it is pushing one part of the brain over, it's bleeding into the CSF space as well, and it's causing damage all the way back. So hemorrhagic strokes are pretty serious stuff. So the fact that there may be a mechanism that is going on is extremely important. Now, before I go to the paper, again, I wanted to understand one more important point. When they look at the blood vessels that are involved, very often it is usually some of these branches inside the brain, the tiny branches, perforator branches, we call them, that can rupture. And these are often the branches that are involved with diabetes and hypertension. And so you can have these hypertensive bleeds in and around this vicinity, which can do a lot of damage as well. And when we're speaking about the arteries that are involved in this research, very often it's some of these smaller arteries, not necessarily the big artery here, like the middle cerebral artery. And so it's an important differentiation point. So let's see if we can understand what this paper was saying. And as I said, I have great respect for the Japanese. You will notice here that this paper is published in June of 2025. We're only in April now. And so this is a pre-release because it was so important. As usual, main author here, Nakao Ota, Stroke Center, Neurosurgery in Japan. And so this is a very important document that they have done, and we really appreciate them for doing this kind of work. And we would hope that much of the other parts of the world catch up with this kind of thorough look through autopsy at what is going on. Um, what is it that they found? I've highlighted a few points here in the paper so that you can see it here. This is the abstract. As usual, it's quite fascinating that every paper is almost as if you can't get published if you don't say this. The rapid deployment of mRNA vaccines for SARS-CoV-2, such as the BN162b2 and the mRNA 1273, provided a critical tool for combating the COVID-19 pandemic. It did have an impact, but the analysis is still ongoing. So we have to be careful with saying that. Now, this is what they were looking at. This study aimed to investigate the long-term presence of SARS-CoV-2 spike protein in the brain tissues of patients with hemorrhagic strokes, examining its potential association with mRNA vaccination. My goodness, they went straight for the question. I suspect that if that was put in a research question and much of the Western world, it would have been blocked. They would say no, because this could raise questions about the problems that could occur with regards to the technology. We don't want to know. As I said, luckily the Japanese are not so bothered. What they found from the abstract here was that spike protein expression was detected in 43.8% of the vaccinated patients, predominantly localized to the intima of cerebral arteries, even up to 17 months post vaccination. Now, it wasn't a huge study, it was only 19 cases, but this is still extremely relevant. 43.8% of the vaccinated patients. Now, what it's telling us is that spike protein gets stuck in the lining of the blood vessels in the brain, and it seems as though it weakens them. And when we look carefully at the paper, and this is why I said I've explained to people that autopsy is the only way to be able to try and understand what is happening yet. And if you don't do autopsy, you are flying blind. But here is what they found when they looked carefully is that the study did not reveal infiltration of inflammatory cells, suggesting active vasculitis. Okay. Vasculitis is an inflammatory process in the blood vessels. However, they did find CD4 positive T cells, CD868 positive infiltration, as well as CD8 positive cells infiltration into the adventitia, that's on the outside of the blood vessel. So it's more like a chronic inflammatory process. So not an active vasculitis, but a chronic inflammatory process that's weakening the blood vessel lining. And they hypothesize that the expression of spike protein drives T cell immunity, leading to hemorrhagic stroke. This is big stuff. And this is as straight to the point as you can get, because they took the time to try and differentiate where the spike protein came from. They didn't just assume. They went and got not only autopsy samples, so meaning if the patient died, they went and examined the tissue. But if the patient also had surgery done, where they were evacuating the hematoma, they also took tissue from patients who were still alive. That is how determined they were to try and figure out what was going on. And when you look at the paper in quite in detail, as I said, they took the time to separate out not only if the spike protein was from the vaccine or whether it was from infection, because they looked for nucleocapsid, which would be another part of the virus you'd expect to find if it was infection. But they also looked for characteristics with regards to mRNA. Here is the list that they have of all the patients. So male, females. One of the interesting things is that females seem to be more affected than males. But you can see here they have history of previous COVID infection. He's hearing no, 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 no. There was a yes here. There was a yes down here. History of mRNA vaccination. Yes, 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 yes. There were a few no's. And then it was up to 3, 4, 5, 3. Some people had 7. And the time from last vaccination to surgery, again, they've put the time frames in. Then they break it down by immunostaining of spike protein versus nucleocapsid. And you can see for most, it was negative for nucleocapsid, which would suggest that it wasn't viral infection. So they really went in detail looking at this. But the picture I was trying to see if I could get for you to understand is that it seems that spike protein can get lodged in the lining of blood vessels. Now, based on the information from Denmark, I think I've always argued it doesn't matter the source of spike protein, whether or not it comes from infection or whether it comes from vaccination. it seems to be able to, in some people, drive an inflammatory response in blood vessels. Because the pressures in the brain are so high, what can then happen is that if the blood vessel weakens, it can then cause it to pop and then bleed. The implications over the longer term are quite serious, especially because we still have circulating virus. And one of the things that the virus does is that it dysregulates blood pressure. For I have observed in my anecdotal observation, up to 4 to 6 weeks after the infection, people's blood pressure just go off the scale. What they have to learn is that you don't let your blood pressure go out of control. Because sometimes talking about these things, people may ask, well, I don't know if I have spike protein circulating, and there is no easy way to test. However, I am working with a company who is producing a test, hopefully soon. If you're interested in that, look in the description, click on the link, fill in your concerns. That way, when it's available, and hopefully it will be soon for those people who want to know, I think in time everybody will want to know. But that is what we're going to have to try and understand. Because if spike protein is circulating, based on what we're seeing here, it seems it could increase the risk that it gets deposited in brain arteries. If that's the case, it could weaken those blood vessels. And in people who already have damage to the lining of the blood vessel from, say, diabetes or hypertension or something like that, that weakening can further, with increased pressure, lead to a hemorrhagic stroke. That's the kind of thinking. So the first point, as usual, as I say, is that it's never just about the one-off moment that, oh my goodness, everybody's going to have this. No, there are people who are predisposed to having these events. And this would be what was in place beforehand. And so then what would happen is that the final push may be weakening of the blood vessels by the spike protein. Really, really critical stuff. And as I said here, and just in case people have come to watch this later, this is kind of like what it would look like. It's these blood vessels here that get weak, and then they can pop and then bleed. And as I said, these blood vessels are oftentimes the ones that are involved in diabetes, hypertension, some other chronic conditions. And so we will find that there is a higher risk in those cohorts. As to why at the moment the early research is showing it to be occurring more frequently in females, we don't know. But that's again an important area that needs to be addressed. Your takeaway at this point is not to be afraid. You focus on what you can control. And what I say to patients very often, what you can control that can significantly reduce the risk of any kind of bleed is your blood pressure. If you know your bank PIN number and you are in the high risk group, you definitely need to know your blood pressure. And so that's the expectation that you have control over and you should therefore address. If you go to the Vision Health Learn Worlds on the McMillan Research, we have a free course there explaining about hypertension, especially in relation to COVID, and we give you a free downloadable PDF for you to monitor your blood pressure. That's within your control, and that's what I'd expect everybody to do. But we're only starting to uncover the stuff that is coming in the near future. There's still going to be a lot more because, as I predicted, autoimmunity triggering damage in multiple organs, not just the arteries, is going to be one of the biggest challenges that we face over the next 5 to 10 years. Hopefully, we can find ways to mitigate it. But stay with us as we continue to explore the science. Have a great evening.